So before starting stretches, we're going to go into them here in just a moment. I just want to go through a quick safety. If anyone is, I don't think anyone probably is, but if anyone still has drains in right now, we want to make sure you don't want to lift above shoulder height right now and move above shoulder height. If you are new out of surgery or any kind of surgery, just your incision should be fully closed and healed before you start. Scars are okay. It's the incisions that are not fully healed yet that are an issue. And then if you personally have been told any other restriction from your surgeon, we're not doing any strength training in this. We're just doing stretching. So hopefully that's okay as far as weightlifting restrictions. But just think about anything you've had conversations with your doctor. And then skin should be healthy. This is more for radiation. You shouldn't feel like you have really, really fragile, thin skin. You probably have already been told by your doctor or your team if you do. And so we don't want to stretch too intensely if you have that. And then again, if you're still in the healing process with radiation, you just want to make sure that you have clearance from your radiation oncologist for any concerns there. Okay, so we're going to go into stretching. We're just going to do 5-10 minutes. We have 5 different stretches. And what we're going to do, we're going to do one at a time. And I try to put them in order. So all the laying down ones, like there's 3 are together, and then the standing or sitting ones are together. And I'm going to try to, before we start the stretch, I'm going to explain what muscle you're stretching and also explain why you want to, what you should be feeling. And then there's a video of me talking. So I'll stop talking during that time, walking you through it, and you can join along or you can just take notes and try them later, whatever works for you, whatever feels good. When we do these today, everyone's going to feel a little different. If you're new to stretching or you're new to these, start with small holds, like 3 to 10 seconds, nice and gentle. And then if you've been doing stretching for a while, working up to a minute or two when you're holding it's great. You can do that. You just don't want to jump into that right away. You will not feel good. And the point is to feel good. We say progress to 1 to 2 minutes. That seems like a long time. And the reason is we know research-based that if someone has radiation fibrosis or scar tissue with their tissues, like muscle tissues, that longer holds help elongate that tissue better than short holds because of the changes to the tissue. So that's why, if you've been doing this for a while, we want to gradually build up. It's more beneficial for you. And then consider posture muscles. So as I sit here rounded forward myself, do you have a desk job? What have you been doing? Are we kind of rounded? We want to consider your hobbies, activities, things you enjoy doing, and focus on those muscles as well. So I added those in. And then modification, when you do these today and when you do them on a general basis, you want to feel, I always like to say, a mild stretch or moderate at most. It should never feel intense. You shouldn't be cringing. You shouldn't be tensing up because that defeats the purpose of stretching. You should feel relaxed and just feel that mild stretch that you can kind of sink into. I'm also going to encourage you to add a deep breath with all of these stretches today and all of your stretches specific for tightness, because especially for those who've had radiation, you have muscles, deep muscles that sit between the rib. That's where this picture is. Those are rib bones and then little muscles between them. They're called the intercostals, and they can get affected by radiation too. And so if people have rib pain or tightness that feels deep, we and therapists, it's hard for us to massage those out, work them out. It's hard to stretch them. They don't move very far. They're just between the ribs. So adding a deep breath, feeling your rib cage expand while you take that breath. Our goal is to try to also help your deeper muscles so we can all play a role in helping you get rid of some of that tightness you might feel. And then last modification, this is just extra. You probably don't have access right now. This is, you can either use your hand or, oh, I didn't grab some, I should have. Dicem is a little sticky tool that I use. You can get on Amazon. It's for like opening jars. And we can localize. So if you're doing a stretch and you just don't feel it where you should, we can gently put your hands somewhere and gently pull the skin down during a stretch. It can help you localize the stretch for you. This is a video I will just show what this looks like with the Dicem. I'm not sure if she's using her Dicem or hand, but let's see.
Control how much tension they feel through this process to feel a mild to moderate stretch, pausing for just a second, and then coming back out.
So that piece, that red piece there, I'm actually pulling down towards her opposite hip, just really gently. You can use your hand on your skin for the same way as you do the stretch, and that'll help you localize right to where you might feel it, which is typically right around the shoulder there, the armpit. So that's a modification. I don't go too far into that, but just wanted to throw that out there in case someone wanted to try. Okay, we're gonna start stretching. So the first you are laying down, I'm gonna do my best to try to talk through it with you and show the video. We're gonna focus on the muscle that I see every day and hear every day is the type 1 for 85 to 90% of individuals that I work with after their surgery or radiation. It is the big pec major muscle across the chest. This is when you try to reach up, you feel it right across the chest, or open up, you feel it tight here. And so this is one of my favorite easy ones to start with. And so I'm going to play it, and I'll go through it twice so you can watch once if you want, and then you can try for the second one, or you can just do both. So here we go.
For this exercise, we're going to lay on our backs with our knees bent and our feet down on the ground. We're going to put our hands behind our head, elbows pointing towards the ceiling. We're going to let those elbows fall out to the side till we feel a mild to moderate stretch across the chest. And from there, we're actually going to keep that position with our arms and allow our knees to fall over one way. You'll feel a stronger stretch across the chest, down the side, maybe even into the hip area. And then we'll come back to the middle. And we're going to go over to the other side, same thing, back to the middle. If you have any pain, try not going as far with your legs. You should feel a stronger stretch, but there should be no pain. If someone has a history of back pain, you also need to consider that maybe you take out that rotation for any pain. You're going to go back and forth 20 times total.
Okay, so I hope that makes sense. Said scaling would be maybe don't go as far with your knees or take out the rotation. It might just feel good for you just to open up your elbows today. Take some breaths in that position. Okay, so we're gonna go through these together. You can go at your own pace. You don't have to go at the same pace I do. So here we go.
So if you're following along, we'll get started. Fall over one way, back to the middle, and the other way. Try and keep your core somewhat engaged, that you're not just arching into your back the entire time, but we're rather protecting the back and just feeling the stretch along the side of the chest. Back and forth, nice and slow. Feel that mild stretch going each direction. Good, we're coming up on halfway. If at any time you need to stop sooner, that is just fine, but we're gonna keep going. 5 more on each side, nice and gentle. Good, feel that stretch. Maybe you can get a little bit further, and maybe instead of wanting to keep moving, you wanna hold a little bit longer. That is just fine as well. Good, we have 2 more on each side. Feel that rotation. And then last one on each side. Over one way, and then over the last way. And then relax. For this exercise,
Oops, sorry. So that's the first one. Said I like this one, that even that positioning go to, if I were to pick one thing for someone to do, and like lunch break or at the end of the day or in the morning while you're in bed, even getting your arms open and rotating a little bit if it feels good on your back is a really good one just to open up the chest. Also really good for posture.
for this exercise, we're gonna lay on.
Hold on, use my arrow instead. Okay. This one is also one of my favorites. This one you can get a little bit stronger stretch. It's the same muscle group because again, this is the one that I see most people get tight with. This one you're going to, the directions we'll share again, but you're going to lay on the opposite side you want to stretch. So if you're really just tight on one side, maybe you only had surgery radiation on one side, you want to lay on the opposite side for this one. Okay, same muscle group. You might feel this stretch a little more intensely than the last one. So scale that to only feel mild to moderate at most. And this one will add in a deep breath as well. So here's some directions and we'll go into it.
So laying on your side with your knees bent and stacked up on top of each other. You can have a pillow if you'd like, but the upper arm you're gonna put behind your head, the hand behind the head, elbow pointing forward in front of you. And what we're gonna do is we're gonna open up to try to think about pointing the elbow to the wall behind us, only stopping when we feel a mild to moderate stretch, not intense. At that point, we're gonna take a nice big deep breath, feel your rib cage expand, and let your breath go, let yourself sink further into the stretch. Hold for a few more seconds, and then gently come back to the starting position. And you're gonna repeat that 3 times. So if you're following along, here we go. We're gonna open.
Sorry, I'll give you all a second. I see some people sitting up to watch. So we're gonna go through that a few times. You wanna add that deep breath, see how that feels. Try to take a deep breath right into the area that you feel tight. Here we go.
Up. Take a nice big deep breath in. Let it all go. Feel that mild and moderate stretch. Gently come all the way back to the beginning. And again, open up the chest. Mild and moderate stretch. Take a big breath in. And let it all go. Dropping into that stretch. Hold for a few more seconds. Good, gently come back to the beginning. And then one more time. So open up, chest, big breath in, and out. Hold for a few more seconds. And then gently come all the way back to the beginning. And then what we're gonna do is we're gonna do the same thing on the other side. So I'm gonna switch sides, you can roll over.
And the reason I'm having you do both sides, even if you feel like you only need one, is I think it's really helpful to compare sides as well so that you know what your body is doing and what you're feeling. If you really want to do the same side again, absolutely, that is just fine. But I think it's helpful just to you understand, the level of tightness you have compared to a side that maybe didn't have surgery or maybe did. And that you can kind of monitor that over time as you continue your stretching, in the weeks to months coming. Okay, here we go.
Same thing, hand behind the head on the top. Open up, breath in, and out. Back to the beginning. Open up, breath in, and out. Dropping into that stretch. Good, all the way back to the beginning. If you got one more time, open up a little bit further if you can, mild to moderate though. Breath in and out. Hold for a few more seconds. Good, and gently come back to the beginning and relax.
And that is it for that one. That is one of my favorite ones. Again, I just think it hits the spot. Hopefully you all felt that where you would want to feel that. That would be one that someone could modify and use their hand if they wanted to open up and kind of give some overpressure. That would be one that I would use that modification for. Okay, we have one more on the ground. This one can be a little bit of a stronger stretch, but I wanted to keep them on the floor together. And so you'll just scale this as you need to, again, to just feel the mild to moderate. Most people know what this one is, child's pose. And the reason why I really like this one, it hits the lat muscles, those big wing muscles you have in your back and your sides. And these muscles are really sneaky when it comes to surgery and radiation because not everyone expects these to get tight. But I would say about 20 to 30% of my patients, this is one that when we're testing them and checking them out, we find that this one can get really intense. For some people, the radiation angles to hit this muscle. And for some people, it's just because of the postural changes that happen with the tightness in the front. You get pulled forward from that tightness and it affects the back. And so we just want to make sure that you're balanced, that you feel good. This one muscle will also limit you if it's tight. So if you're having trouble getting your arm overhead really well, this muscle will limit you if it's tight. So I just think it's important to address. So most people know child's pose, but it will be a quick explanation and then we'll go into it.
So what we're gonna do is we're gonna finish in child's pose, get a nice big stretch along the side of the body, and just really make sure we're getting a couple breaths in. So I like to start in a quadruped position, hands and knees, feet and knees, I should say, nice and wide, and then drop your hips down, reach your hands further out if you can, till you feel a big stretch. Hold this position. You can take a nice big deep breath and let it all go. You can hold that for a good 20 seconds or whatever feels good. You can do that a couple times. So let's do that a couple together. If you haven't already started, here we go. Into that position, nice big stretch, and then just relax into that stretch. You can move around a little bit, keep it nice and slow, find whatever feels good. Good, gently come back out of that if you need to. But if you can stay in if you want to, we're gonna go one more time. Find whatever position feels good, stretch out, and add a couple breaths in this round and relax. Good, and gently come up, nice and slow. And then go ahead and finish, because you are.
Okay, I'd actually say you are done, but you're not, because I moved this one. This is number 3 of 5. Okay, so for these next 2 works, you're going to be sitting or, standing for one. So everyone can come back up and take your time here. You might not have a chair. Again, if you have access to just to lean over something, this could be helpful. This is one that is the same muscle as the child's pose. I like this one because we can do a deeper stretch on one side. Or this is one for someone to start out with if they're still sensitive to the child's pose one. It's going to be working, again, that same side muscle that gets tight. I'm going to be sitting in, you can see, in front of a small table. So if you have access to sitting in front of a table, great. Again, if you don't, you can sit in front of a couch or chair or just over an ottoman or something, or take notes and try this one later. So here's the directions.
The next exercise, we want to make sure that we're sitting at a table. So either you can have a side table or you can be sitting at your kitchen countertop or at your dining room table. We're going to sit up nice and tall at the edge of our chair or our couch, and we're going to have the table out in front of us a little bit. We don't want to be too close to the table. From there, what we're going to do is we're going to put our arm gently on the table. You're going to stay nice and upright, nice and tall, and leaning from the hips. You're going to lean forward and reach your arm across the table. This will allow for a stretch on the side of the body or under the arm. When you get out there, you're going to hold for about 5 to 10 seconds. Make sure you take a deep breath when you're out there and relax into that stretch. And you're going to do that about 3 times. And we're going to do that on each side. So if you're following along, sit up nice and tall, lean forward.
I'll pause just a moment for someone to move. Again, if you have even a yoga ball or anything just to lean forward with, try to keep yourself up nice and tall with your chest, your trunk area, and lean forward at your hip as much as you can in the position that you have right now.
Do you feel that nice gentle stretch? Take a nice big deep breath in. Let it go. 2 more seconds. Gently come back up. And again, reach out, feel that big stretch on the side of the body, under the arm. Breath in, and let it all go. Hold for a couple more seconds, and back up. And one more time, we're gonna see if we can go a little bit further. So reaching way out in front. Breath in and out. Hold for a few more seconds. And then gently come back up. We're doing the same thing on the other side. You are welcome to do both at the same time, but sometimes you'll feel a stronger stretch doing one at a time. Feel that stretch. breath. And up. And again, reach out there to feel that mild, moderate stretch. Should not be painful. Breath in and out. Good, and up. We got that one more time. Reach all the way out. Feel that stretch. Breath in and out. Hold for a few more seconds. And then gently come back up into sitting. The next.
Oops, there we go. Okay. So again, you might feel that was a little different than child's pose. So if you like one or the other going forward, or again, it just fits where you are in the day. You're at your desk or you're at home, you can pick one or the other. It's similar muscles, just a little bit different way to do them. Okay, we have one more, and this one can be done in sitting or in standing, whatever someone prefers. Ballerina stretch. I don't even know if that's the formal name. I've always used it. So this is going to look pretty familiar. Still going to be that side of the body, side of the chest. You might feel this a little bit in the front if you're tight as well. We're going to do both sides where we're going to take one hand, reach our wrist, and then going up and over. Again, feeling that stretch. This one's a little bit easier to follow along, but let's watch first.
So what we're gonna do is you're gonna put your arm up overhead and you're gonna take your opposite hand, grab that wrist, and you're gonna pull it up and over to the side, feeling a nice big stretch down the side of the body. So you can take a breath there, you can hold it. We're gonna try to hold for about 10, maybe 15 seconds, and then we're gonna repeat on the other side and do them each twice. So following along.
So again, if that anything irritates, some people don't feel good when they take their hand and pull. Even just reaching up and over without any pulling, that can bring or modify this stretch a little bit so it's a little bit more comfortable. And if just going up and over doesn't feel good on the shoulder, maybe just try going across the body or going back and trying to doing kind of more of an opening like one of the first two. Again, find something that feels good. Don't go into any pain.
Long up, grab that wrist, pull it up and over, bend over a little bit. Nice big stretch. You can take that breath in and out. Feel that stretch, a few more seconds. Go ahead and gently come out. Take the other hand up and over, grab that wrist, pull it even further. Feel a nice big stretch on the side of the body. Take that breath if you'd like. Really feel that side body stretch. A few more seconds. Good, relax, and one more time on each side. So up and over, grab that wrist and pull it up and over further. Nice big stretch. Ever feels good. Go ahead and relax, and one more time the other way, up and over. Gently pull that wrist up and over with it. A few more seconds. Good, gently come down and relax.
And that's it. So like I said, I tried to pick the muscles that you might hopefully where you felt it the most. Hopefully you can maybe have one or two of those that you felt like, hey, that hit the spot. That is exactly where my tightness is. That's where I feel like I need it the most, and that you can be consistent with those. So once a day is plenty. If you really want to do it more than that, you can. They're safe to do as long as you're gentle with them. But once a day, or even every other day, or just find something, before you get out of bed, or when you get in bed in the evenings, or whatever that might be, that you can take a minute or two and do one of those. I think it can make a really big difference. And like I said before, that cycle that happens with these tissues means that consistency is key. And so just finding something that embeds into your routine to kind of hit these muscles, hit these spots, I think can be really helpful for all types of tightness. Doesn't matter really what's causing your tightness specifically. I have a bunch of references just for those who are interested, but I'm happy to stop sharing my screen, or I can see the chat, I guess, and answer questions if anyone has any. And Kelly, if I'm missing something in any Q&A